And welcome back to Local 4 Live on this Wednesday morning. And Wayne State University is launching an urgent new study to help veterans struggling with PTSD and depression. Now, according to the VA, between 2001 and 2022, nearly 4,300 Michigan vets lost their lives to suicide. Now, to tackle this, Wayne State has secured a nearly $20 million grant from the Michigan Cannabis Regulatory Agency to study how marijuana might improve veterans' mental health as well as quality of life. The research team is now recruiting veterans for a 12-week program that tests different levels of THC and CBD, those are the main compounds in cannabis, to see how they impact mood and well-being. And this is crucial work aimed at making a real difference for veterans. So joining me this morning for a conversation about this study and how it'll work is Dr. Leslie Lundahl as well as Dr. David Ledgerwood, who are both psychiatry professors at Wayne State University and the two people behind this study. Good morning. Thank you for joining us.
Good morning. Thanks for having us.
So when it comes to this particular study, looking at how this can affect people, what have you seen in terms of marijuana being able to help with PTSD and with depression and the things that veterans go through?
Well, right now we're just starting to recruit, so we don't have any data really. We can speak to emerging evidence from cross-sectional or observational studies that show that it may be helpful for specific symptoms of PTSD. But this will be among one of the first well-controlled randomized clinical trials that will take an experimental approach, a gold standard experimental approach to see if cannabis in fact does have potential benefits. Knowing that it does have harms as well. So taking a balanced look at both of those.
And and what are some ways, I guess as the study will go on, that you'll be able to weigh the good and the bad of what can come from the use of cannabis to try to help people's mental state?
Well, we're going to be having people dose themselves over a 12-week treatment period. We're looking at specific formulations of THC and cannabidiol or CBD. We'll be following them very closely through weekly assessments and long-term follow-up, and there are certain outcomes that we're looking for. Specifically, we're interested in the symptoms of PTSD, hyperarousal, startle, fear, anxiety, sleep problems. We'll also be looking at neurocognitive function. Does cannabis change memory, attention, pain, quality of life overall, sleep dysfunction? And I guess through following that and then looking at various harms, do people, start to develop a cannabis use disorder? Do they have an increase in anxiety? So balancing those kinds of outcomes.
And another, I think, really important part of the study, which is really novel, is there's also sort of an imaging component to look at elements of brain inflammation related to cannabis and sort of whether cannabis affects brain inflammation. A couple of our colleagues who are neuroscientists in the department are spearheading that part as well.
And it feels like over the last maybe 15, 20 years or so, the use of cannabis marijuana is slowly being better understood, I think is probably the best way to figure that out. When it comes to dealing with this, have there been other studies similar to this, and maybe not dealing with veterans, but in other situations that would kind of help lead you in a certain direction too?
There have been a handful of studies, only a couple where they actually administer cannabis. It's very difficult to get through regulatory hurdles to administer cannabis to humans. So this is going to be one of the biggest and most well-controlled studies.
Yeah, I think, one of the things that we've really sort of found over many, many years is oftentimes we're both also psychologists, and oftentimes our clients might come to us and say, they get some benefits from cannabis for pain or for sleep or for other things. But honestly, there are very few controlled clinical trials out there that actually document the extent to which people actually across the board get benefits from these things, and also for what people might get benefits from cannabis and what people might be harmed by cannabis. We don't actually know that, so we take a very sort of agnostic approach, scientific approach, to try and understand in a very rigorous way, in what ways might cannabis help, and what ways might it not help.
And when it comes to, we often hear about PTSD and depression being a major issue, particularly with veterans who served in combat zones and things of nature. Just to get an idea of, we hear about how difficult it is, but seeing it firsthand, how bad is this problem?
Well, PTSD affects about 6 to 10% of the general population, but estimates in veteran populations is up to 30%. So it's pretty prevalent, and the symptoms are quite disruptive. So there's difficulty sleeping. People feel like they're fearful in situations where maybe they don't need to. There are intrusive memories, things like that. So it does affect people's lives for sure.
And I would just sort of add to that. I mean, we've both sort of seen many people over the years who experience pretty much debilitation as a result of their PTSD symptoms. We also experience, have worked with people who are functioning sort of through life by just really struggling through their symptoms. But we've also met with many people who have actually been able to successfully get better.
And obviously,
I think one thing that's important is, the science is definitely moving, but it's moved slowly. Good science takes time. But I think we've been far outpaced by public opinion, where people think this is medicine, that it's curing all kinds of things from anxiety to depression to chronic pain to reducing other drug use. And there are some data possibly that support that, but we really need to have rigorous data to show more evidence of that.
you said it best right there. Good science takes time. This is Dr. David Ledgerwood and Dr. Leslie Lundahl from Wayne State University. Thank you so much for joining us this morning.
Thanks for having
so
us.
Now we're continuing